Hello and welcome everybody to our lunch and listen session today. It's lovely to have you with us, whether you're with us live or whether you're watching this back later. My name's Kate Legg and I'm one of the practitioners that works with Dementia Carers Count. I'm an occupational therapist by background, and most of my experience is in older persons mental health services. I'm joined today by Lorraine Haining, who is one of our specialist practitioners and who is a Queen's nurse, who I'm sure you've seen before in some of our sessions. One of the sessions we've covered before is looking at daily needs, and if you haven't seen that, it's available on our YouTube channel. So hi Lorraine, is it right if you can introduce yourself a bit more?
Hello there, Kate. Yeah, and welcome everybody. My name's Lorraine Haining, as Kate said, and my background's in nursing, mental health nursing, but I worked most of my career in the dementia services, so across a range of services from the NHS to the care home sector to the retirement village sector, and I'm a practitioner here at Dementia Carers Count.
Thanks, Lorraine. So our topic today is managing medication at home, and it's just an opportunity to think about some of the safety things around managing medication and some tips from ourselves. If you have any questions, then please do pop them in the chat room or in the comments box. If you want to do that privately, then you can do that as well, and we'll aim to answer them. We can't give specific advice about specific medication to individuals, which I'm sure Lorraine will explain later, but we can give general advice. So if you want to pop your questions in to feed through to us, that would be brilliant. But just to get started, Lorraine, I think you're going to start us off with a picture, if you can, aren't you, to think about medication safety.
Yeah, I'm going to share this. There's a lovely little document that came out, a poster that came out from the World Health Organization around the kind of 5 moments for medication safety. And we thought we would just have a look at that today, because I think there's lots of safety issues about medication people don't always think about. I'll just pop it up, Kate. So here we go. We'll share it so that people can see this. Okay. So
yeah, I can see it. Lovely.
You see it okay? You're fine.
Yeah.
Yeah. So obviously they've kind of looked at the areas in medication safety, and obviously the first one is when you're starting a new medication. So and it's really important to understand what that medication is for. So ask the doctor what it's for, and they should be whoever prescribes it should be telling you why you need to take it. But also the kind of risks, if there's going to be any risks in terms of, interactions with other medications and making something worse. I think it's important that they explain that to you. And also about the side effects to expect, because most side effects can be transient, so they don't last for a long time. Your body gets used to the new medication and sometimes they will settle. And I think if you know to expect certain side effects, then but it'll pass, you'll continue to take it till you get to that point. And that's important because I've certainly seen in some situations where people have just stopped medication when they've had a side effect and refused to go on with it. So again, an important issue. Again, in terms of taking your medication, it's important to know when you should take that medication, and how to kind of step that out. And usually you get that from the pharmacist, but sometimes you will just say on the bottle, take as directed. So again, it's important to make sure that you understand when you should be taking it and what the dose should be at that particular time. Because that's important, particularly if you've medications where they fluctuate. Doses might go up and doses might go down. There's lots of medications, particularly older people take, that can fluctuate. So again, just making sure you understand exactly what you're taking. There might be some special instructions, so that you either take it with food or without food. That's important because it's about the absorption of the medication as well, and that can have a big influencing factor in how you actually take it. Again, what to do if you do have side effects, who should you contact? Should you stop it right away? Should you carry on? I think just knowing who to ask those questions. And also the importance about missing a dose, because some people might just think, oh, well, I'll take an extra one. And actually that's not the answer. It's important to get some advice about how to deal with that as well. I think the other thing is about adding in a new medication to a regime that you already got. I think it's just asking the question, do I really need to have this, and getting the prescriber to let you know, why you need this extra medication, and how that'll enhance your health. And actually the question you want to be asking is, could it interact with any of the other medications you're on? Particularly if you're on a range of medications, and a lot of older people tend to be on a lot of medication, usually more than 4. So again, just making sure that you understand that. And again, just reviewing your medication, making sure that every now and again, usually kind of every 6 months, I would suggest that, you get your medication reviewed. So, and always ask how long you should be on the medication for. So is it just a short course, should it only be on it for a few days, or is this going to be a long-term thing? Just so you understand the implications. And sometimes it's really good if you can go into your local GPs now usually have a community pharmacist based in the surgery, and you can actually ask for a request to have your medication reviewed. And that's a really good thing to do as you get older in particular. And because there might be medications that you no longer need, that might be making health conditions worse. So again, that can be reviewed and they can be reduced. And I've seen people, walk into a surgery taking 12 medications, coming out only taking half a dozen. So, it can make a big impact on the load of medication you're taking as well. And it's really important. Also, I think older people, their organs slow down, the absorption changes, the way we process medication changes. So again, I think it's important to make sure the medication's at the right dose for that process. And again, so things might be reduced as you get a bit older and a bit frailer as well. So making sure that you get that medication review. There's different levels of reviews as well. Sometimes it's just that ad hoc opportunity when you're in at the doctor, and ask them to look at what you're taking and do you still need all the medication you're on. And then there might be what we call a prescription review. So there's a technical review of the patient's list of medicines that the pharmacist will look at and might change something, but they should let you know if something's changing. And then there's a treatment review where they'll look at the whole patient's notes just to see if things have changed in their health and should they still be taking the medication and should they be taking it at the dose that are. And then there's a medicine review, which is a face-to-face review with the person who's prescribed it, looking at your whole condition and everything that's going on in terms of other medications. So there's a lot to think about. I know that it just seems that you should pick up a prescription and take what you're told, but actually there's a lot more to it. And again, the last thing is really stopping a medicine. So when should you stop a medication? So how long are you going to be on it for? Because that's important. You're taking medication for a particular length of time because we know that that's how long it will take for that medication to be effective. And I think a lot of people tend to, when they feel better, stop. Antibiotics is a good example, isn't it? When you start feeling better, people will say, oh, I don't need to finish this course, but actually it's really important, because if you don't finish the course, quite often the symptoms can reoccur. So it's really important to do that as well. And again, just if you're stopping a medication you've been on for a long time, it's important to know whether you might have some withdrawal symptoms. So some medications, I know that you and I worked in mental health, and some antidepressants can have withdrawal effects. So it's important to understand that and to know what to expect and how to manage that. So again, just asking that question as well. And again, if you have to stop any medications due to unwanted side effects, who should you report it to? Should you let your pharmacist know? Should you let your prescriber know? That might be the GP or a consultant. But that's important as well, because some side effects might be brand new that we don't know about, and it just gets them added to the list that we would normally put out there. So there's a lot to think about in terms of just even taking a new medication, isn't there? I don't think people realise just how complex it actually is. So there's a lot to think about.
Okay, thanks, Lorraine. Can you stop sharing that?
Sure.
And then I can see a lovely face again. So that's brilliant. That's great general advice. I'm just thinking a bit more about now people that maybe are having some problems with their memory, about if there are any tips or things that you can think about to help people remember to take their medication.
Yeah, I think there's a few things. I think there's prompts now, haven't we got lots of prompts now? I think the good thing that this pharmacy will do, most pharmacies will provide you with it laid out in a dosette box, you know, where
Yeah.
it's Monday, Tuesday, Wednesday, and the times are laid out. So again, sometimes that's enough. People just need that prompt to help them to remember it. And I think there's other electronic devices. I think you'll probably be more aware of these than I am, Kate, that can just set an alarm for somebody so that it just rings and it reminds them. And I know there's some that pop up, so you've only got access to the medication you're due to take at that time, which can be helpful if people get muddled up as well. So I think there's things like that. Again, we've now got all these electronic devices in our houses, like Alexas and such like, and we can actually program them to remind us to take medication as well. Sometimes it's like a phone call from your daughter in the morning to say, remember to take your medication, Dad, you know, or sometimes people will need some prompt from a carer, a professional carer coming in, who might need to put the medication out because the person might get muddled up with it, and make sure they take it. Because as we know, memory is not great in dementia for a lot of people. So even laying it out, they might forget that it's there. So certainly a good thing. I don't know if you would add anything else to that.
Yeah, I was just thinking about, so there's lots of different gadgets out there that are all slightly different. So it depends. Some will work for some people and some will work for others. So you're right about the chemist can provide medication in pre-packaged boxes.
Yeah.
But sometimes people struggle to open those or get the little tabs off. It depends on what sort of. So if somebody is struggling, then do go back and see if there's an alternative. Or it may be that there's different types of box in different colours, or so yeah, there's different things, because sometimes it's not just about remembering to take the tablets, it's also about the physical thing of being able to get them out the little pot and get them up to your mouth and get them in. So sometimes we suggest if people take, you know, for carer perhaps is providing a tablet, that they pop them maybe into like a little coloured dish or a little coloured cup or something, so that it's something easier for them to pop in. And there's other pieces of equipment like that as well. So you quite often can get these in shops that provide disability equipment, or you might be able to have a look online. But if you're unsure, do ask for advice. So advice from your pharmacist or potentially an occupational therapist or something like that, if there's something specific. So like you said, prompts to remind, but also practical things in terms of getting things into somebody's mouth.
Absolutely.
Just a couple of the comments. So Kathleen has said that we had no idea about getting medication reviewed. We were never told about it. My dad was very poorly because he was taking the wrong dose.
Yeah, and I think it's a common theme actually. I think we pick it up a lot on our live online sessions with family carers who are not aware of getting a medication review, or that there is a possibility they can even do that. I think there's just an assumption that somebody in the surgery will be looking at this, but actually sometimes you have to prompt it, particularly if something's changed, or you know, the person's exhibiting different side effects, or maybe just something's changed in their health. So again, it's good practice, I think, just to get a review every 6 months, just to make sure, especially if you're older and you're getting frailer. I think a lot of things can change over that particular period of time, and your medication does really need to be looked at to make sure it's the right thing for you at that particular point.
We've had another comment about, which is kind of similar to the remembering thing. It's difficult to know if my mum has taken her meds. Using storyboards has helped, but it's still so hard. That is quite difficult, isn't it, to know?
Yeah, absolutely. It's a hard one, because they might take them out the box, leave them sitting, and then forget to take them. As we know, we've probably come across all these things as well. And I think at that point you have to question, is the person needing more support? Do they need a carer to come in and actually you know, give them the medication and persuade them to take it, and watch that they do take it and swallow it properly? So again, I think that's a discussion around the family, isn't it? Around at what point do we need to step into that level of support that the person might require, because it is quite difficult to know for sure. Sometimes you never know.
So then we've got a couple of comments as well about another situation, which is where people are maybe refusing to take medication or not, or getting stressed at times of medication, and there's some kind of questions about how you might handle that.
Mm. Yeah, I think refusing to take medication, it might be a response to being confused or feeling quite
Mhm.
afraid of what's going on, especially if you don't understand why you're taking the medication. They might also feel like they don't have control over their life anymore if you're kind of saying, you must take this, you must take this, particularly if they've been that type of person, who's been always in control and made their own decisions. And that can actually sometimes make people quite angry or resistant as well. So sometimes it's quite good to just create a nice quiet environment, when it's time for the medication, and try and keep things nice and calm. And I just, no distractions around can be really helpful. Again, just making sure that the person's not agitated or angry when you go to give them the medication, because that's not going to go well. You know that really as
Yeah.
well. And it's also important to find out why they're not wanting to take it. So sometimes it's about the amount of medication somebody's taken. I've seen people taking 12 tablets in a morning, and that's a lot to swallow. As we get older, swallowing can become a bit more difficult, so I think sometimes it's just looking at that medication burden that they've got,
Mhm.
and that might be able to be reduced and spread out, and or some medications as well can be difficult because they're quite large to swallow for older
Mm.
people. So it's looking at with the pharmacist, can these be changed? It might be that you can have it in a liquid form. You might get dispersible options like you have with paracetamol. It might be that we can change it to a patch, rather than
Mm.
swallowing, you can have a patch. So there's lots and lots of options. Again, that's where your pharmacist comes in. They're the expert in this area. So, I mean, as far as I'm concerned, as well as having your doctor's number on the fridge door, you should have the pharmacist as well, because they're the people that really are expert at this level. And I think we underestimate the impact they've got on our health.
Mm.
So again, just having a chat with them about that. It might be unwanted side effects, so they might be feeling quite nauseated. In relation to my own dad who had dementia, and he was on one of the medications for Alzheimer's disease, the initial medication they gave him, he refused to take that. He kept, we'd leave it out, but he just wouldn't take it. And when we explored it with him, it was because it left a terrible metallic taste in his mouth.
Oh, okay. Yeah.
And he just didn't like the aftertaste. So we spoke to the doctor, and it was changed to one of the other medications, which was fine. He actually
Oh,
took
okay.
that. So again, just exploring it with the person, just to see what it is that might be the issue as well. And talking to the pharmacist about that as well can really help to kind of resolve some of the
Yeah.
situations.
So have you got any advice about, sometimes people say that they maybe put the tablets into something else like yogurt or things like that. Have you got any advice about that, or even put them in without people knowing? What's the kind of
Yeah,
advice around that?
I think, well, the first thing to say is you really need to get advice before you do anything like that, really,
Mhm.
because sometimes it changes the absorption of medication. When I've seen people crushing tablets, and sometimes crushing the tablet can change the way that the tablet's absorbed in the body, and it will not have the effect we expect. Some people have seen open capsules and put that into a drink or whatever, and again, that can change the way it's absorbed. They're in these formats for a reason. And again, you need to again speak to the pharmacist about the issue you're having, and take advice from them as to how it works as well. And again, giving it in a way that's covert is not
Mhm.
really the right thing to do, because you're giving it really against the person's wishes again. So there's lots of guidance around that, really. And certainly in hospitals and care homes, as you know, Kate, there's
Mhm.
very specific guidance that we have to follow if a person refuses to take medication. And there's a covert pathway that we have to follow, and make sure that that's all care planned as well. So we have to think about the principles of the Mental Capacity Act when we're making decisions, in the person's best interest. So, is it going to be a benefit to that person to give them it covertly? What's the least restriction option, that how we can do that? And we also have to take into account the wishes of the person, because I've had some discussions around this with some staff about particularly the flu jab. So family members might want their parent to now have the flu jab, but for years that person's refused to take it because the belief was they didn't want it. But now, because they've lost the capacity, the family would now want them to have that. But you must take into account the person's wishes prior to them having dementia and that loss of capacity, and that has to be considered in any situations as well. And you also have to consult other people that are involved with the
Mhm.
person, so the family, what's their views on this, any other relevant healthcare professionals that are involved as well. So get all that professional input, and then obviously try and encourage the adult to make a decision on their own if they can, maybe get some different options, look at other ways you can give medication, and make it as easy as you can for them to actually make the decision themselves. And then failing that, obviously, you would look at the best interests of the person before making that decision. But again, that should all be discussed professionally,
Yeah.
and even for families at home, they should be following these best interest principles. As I say, it's a bit easier for us in the private and public sectors to do this, but for family members, it's just good that they're aware of these principles, I think, in terms of making decisions around capacity for a person in terms of medication.
Brilliant, thanks, Lorraine. So definitely get advice.
Yeah.
Just a question just around dementia medication and when and why it might be prescribed. So why do some people get it and other people not?
Well, it's a really good question, actually, Kate, because I think it comes up quite a lot, really. And the reason is really that it's to do with the diagnosis the person gets. So I think primarily when somebody's diagnosed, it's usually people with Alzheimer's disease that would benefit from taking what we call the cholinesterase inhibitors. They're medications that are prescribed specifically for Alzheimer's disease because of the way that they work in the brain. It's not a cure, but it is used to treat some of the symptoms in the earlier stages. There are 3 cholinesterase inhibitors that are available for Alzheimer's. So there's donepezil or Aricept, and there's rivastigmine or Exelon. They've got a chemical name and a trade name, and there's galantamine, or it's called Reminol as well. And they all work in a very similar way. And there's really, it just depends which one you find better for you. So some people might get side effects with one but actually tolerate another. So again, it's just a matter of trial and error, really, to see what works for you as well. As I say, they're usually given to people with a mild to moderate Alzheimer's disease, and for a while it'll kind of slow down the changes that are happening, but they don't work forever. Eventually that will wear off and the disease will continue to progress. But I've certainly seen, in reference to my own dad, he was one of the people who had a really good response to it. And even, once he had, we usually start off in a very low dose just because of side effect profiles. So we just want to make sure you don't have side effects with it that are difficult. So we start very, very low, and we'll what we call titrate. So we'll increase that very slowly and try and get you up to the highest dose that we can. And in my dad's case, he really responded well. And in fact, we found that he was able to do some things that he had lost the capability of doing. So for us, it was a real good story, really. He was one of the very good responders. They don't work for everybody. It's important to say that some people just don't get any benefit, and some people have very bad side effects and can't have them. And sometimes they interact with other medications that older people are on, and people can't be prescribed them. So there's lots of ins and outs to it, but it's usually prescribed for people with Alzheimer's disease. That tends to be. Sometimes for Lewy body dementia, I've seen it being prescribed as well, depending on but there's lots of pros and cons to weigh up in terms of why you should prescribe it or why you shouldn't prescribe it. I hope that helps.
Yeah, so it's that thing about how things interact with each other as well, isn't it? And
yeah, absolutely.
And like you say, sometimes the benefits better outweigh the side effects, but equally sometimes it's the other way around. So
yeah, absolutely. And we're all different. We keep saying that, don't we, in all our sessions? We're all individual, and individual circumstances. So again, that, whoever's prescribing it will look at all that. They'll look at your current health levels, medications you're currently on, your circumstances in terms of, will you be supported to be able to take these, because you have to take them on a regular basis. Missing them can have a negative impact. So there's loads of things to weigh up in terms of prescribing of them. I should say these are usually initially prescribed by a specialist, so usually a memory clinic, or by a neurologist sometimes, or a specialist geriatrician. Quite often they're the initial prescribers, and they'll monitor it for usually about 3 months, just to see how the person's coping with it, you know, and if it's having a positive impact. And then if things are going well and they want you to continue with it, quite often then it's passed back to the GP and you just get your medication as normal and they'll prescribe it. But in the initial instance, it's usually a specialist who'll prescribe it.
Okay, thanks, Lorraine. We've had a couple of comments from people, thank you, about situations they're experiencing, and I think one of the themes is about people refusing and becoming quite distressed. So I think we've covered that. I think one of the comments is we'll probably respond to later on because it's a bit personal.
Okay.
So I don't really think we should discuss that one in front of everybody, but
Yeah,
we will get
fine.
back to you, just to be reassured, we will get back to you. Somebody has said that their mum had been in a care home and had been refusing, but because of the way that the staff managed it, that had improved. So
Yeah.
that's good. And then another person said that they gave their dad a fidget toy whilst he takes his meds. It keeps him calmer and distracted. And at the moment, I find this gets us through. So
yeah, I
that's
think
something the actual
distraction
thing.
works. It works really well. You know, I think, you know, just sometimes it's good to buddy up. You know, so if you're taking medication, they're you know, to take it at the same time.
Yeah.
You know, so we'll do this together. I think things like that. As I say, the pharmacist, if the person's in a care home or if in a hospital, speak to the professionals. They deal with these things all the time, and they've usually
Yeah.
got lots of little nuggets of information just to help you with certain things. The fidget toys are brilliant, actually, you know, in terms of distracting a person. It just takes their mind off things while you're, you know, getting them to take the medication. That can be quite helpful as well. Sometimes having a treat after it, you know what I mean?
Yeah,
So
I was just thinking that actually.
yeah, we'll have a nice cup of tea and a
Smarties.
scone after it, you know. So something like that, again, just to encourage the person to take it as well. And again, I think I'm one of these people, I just like to explain to somebody why they're taking it, you know, if they're still at that stage where they can understand you're taking this because this will help your memory, you know, continue to improve, or whatever it might be that the medication you're giving the person. I think sometimes just explaining to them why they need to take it can go a long way for them accepting that they will, you know, and not just assuming that they understand, because we know that the memory doesn't, you know, keep information, you know, when
Yeah.
you've got dementia. So although you told them yesterday, you know, the next day they might not remember why. So again, just that repeating why they might need to take it can be helpful.
Brilliant. Thank you. I'm going to have to wrap us up because, believe it or not, the time
Gosh.
has whizzed by, but thank you. We did, yeah, thanks for your question. Some of the questions that we haven't been able to answer, we will get back to you personally. But thanks for joining us. It's a really important topic to think about. Please join us next Thursday. We've got our next Lunch and Listen session, and we'll be posting details about that shortly. And also, please do look online at the other courses that we offer, which cover a variety of topics. So there's some coming up even in the next few weeks that have spaces available. So have a look online and see what we've got available. Yeah. And if you've got any other questions, then do send them through to our support email. And we do also have a support telephone line if you want to just get some more direct support. But just in summary, just thinking about making sure, if you have got concerns about medication, making sure that you go and get advice from pharmacist or your GP, or if you're connected to a memory clinic or something like that.
Absolutely. And I think what we can do is, Kate, that little poster we put up at the beginning,
Oh,
we
yes.
can put that up on our website so people can
Yeah.
have a look at and download that if they want to. It just gives you some prompts to think about when you're at the different stages of taking medication.
Yeah, useful for everybody, actually, isn't it?
Absolutely,
Everybody that takes
totally.
medication.
Yeah.
Brilliant.
Yeah.
Okay, thank you very much, Lorraine. Thanks for joining us, and thanks everybody.
Thank you.
Take
Thanks
care.
everybody. Take care. Have a good day. Bye.
Bye.